Just to say to the group who our panelists are today, and they've got larger bios than I'll read, but I'm going to let you know what their positions are. All of them have a relationship to the School of Social Work, and this is really our gratitude to all of them for helping to educate the next generation of social workers. And we've known these colleagues for, in most cases, a number of years. We're very appreciative of them. Let me just tell you who they are and what their titles or their work is right now, and then we'll start our time together. Melissa Chalker is a social worker, and she's been the executive director at the New Jersey Foundation for Aging, and has really been with that organization since 2008. If you want to know something about the needs of the elderly, the Elder Economic Security Index in Melissa, she's probably in New Jersey, she's probably the person to ask because she was one of the developers of that scale. We're very glad to have her here, and she's also a part-time lecturer at the school. Lacey Davis is the executive director of the Family Support Organization of Union County, and has a very varied career, diverse, talented career in law enforcement and also in human services. And we're so grateful for his participation today. He continues to host students at his organization, also in field. Rosalind Ford's a wonderful friend, director of behavioral health at Hyacinth, and she works very supportively in the intensive weekend program at the School of Social Work in Newark. She's a Rutgers alum and a good friend, and also a field liaison and a field instructor for our students. The Reverend Gena Jefferson, what a pleasure to meet her. I know that she came to us under Rupa Ketterpal's auspices, and we're thrilled to have her today. And going from her previous career as a public school teacher and social worker, this is Reverend Dr. Gena, has been the founder and CEO of JAIA, Just As I Am Youth Empowerment. And she works also with older adult clients and is co-owner of Overture Wellness Spiritual Life Coaching Body and Mind. Renee Koubiadis is the executive director of the Anti-Poverty Network in New Jersey. And the person who we want to be speaking with when we're really trying to assess needs of New Jersey's families. Renee is an undergraduate of Rutgers and a graduate of our sister school across the river, Temple, for her MSW. And she has deep experience and connections to the NASW New Jersey, and most recently was named in May 2020 to the New Jersey Restart and Recovery Advisory Council to Governor Phil Murphy. Tamika Levels-Hood is a graduate of Rutgers and is Vice President for Homeless Services at the Volunteers for America, Delaware Valley in Camden. Works with our students in Camden, undergraduate and graduate, as a field instructor and a field liaison, and has been doing great work helping the next generations of social workers enter the profession. Lorianne McGuffin is the Director of Clinical Services at Crossroads program in Willingboro, New Jersey, also a field instructor at Rutgers, part-time lecturer, and a field liaison, good friend. Charles Thomas is Program Director of Fletcher House at the Volunteers of America, Delaware Valley in Camden, New Jersey. Fletcher House is an organization which meets the needs of people perhaps who many other institutions have not been so optimistic about and have given up on, and instead Fletcher House makes a case for why people should find work and indeed continue on with post-secondary education. And Charles has been a field instructor, a field liaison, and a great support in our Camden office. And then finally, the Reverend Susan Victor is Director of Counseling and Support Services at Womanspace Incorporated in Mercer County. Womanspace is the lead service provider for victims and survivors of domestic abuse and sexual assault in this part of the state. And she is the agency's chaplain and has been the field instructor for our social work interns. She is also a minister. We have two clergy here today with Reverend Gena and Reverend Susan. So I don't know what to say about that, except maybe we're in good hands. I don't know, but we'll continue on. And we have a Zoom room full of educated, committed, passionate people. And we're very interested in discussing how do field agencies respond to the two pandemics, COVID-19 and structural inequality and racism. And we know that pandemic really does mean, it's Greek for pandomos, and it means all people. And that's really what we're talking about. How are all people affected, and how have our organizations been working in these two domains? So I'm going to turn it over to my colleague, Renee Thomas, and ask her if she'd pose a first structured question to the panel and let's get underway.
Good morning, everyone. Welcome, panelists. Welcome, faculty and students and other agency representatives. Just thank you so much for joining us this morning. I'm going to jump right in. To just really tap into our panelists and their experience and what's really happening right now at your agencies. And, you know, I want to leave with a question just to kind of promote interaction and your thoughts about this. The first question I wanted to ask is, how would you describe the effects of the two pandemics upon your organizations, your clients, your staff, services, and mission? I know in many professional circles, it is referred to as the twin pandemics. And so highlighting that concept as well, how would you describe the effects of the two pandemics upon your organization, your clients, staff, services, and your mission? Just wanted to open it up right now. We just really want to hear from you about what's taking place. If you want to, I know if some of you are muted, make sure if you're a panelist to unmute. You can also put your blue indicator hand up as well. That'll be awesome.
So I'll jump in union. DeLacy Davis at the Family Support Organization. What we've seen in terms of the pandemic is greater food insecurity, greater signs of depression, anxiety, and not only with the families that we service, but also with the staff. And so it's forced us to have to rethink how we work, the kind of work that we do, and how do we help the community, but also help the family members who we are also family members with special needs children. And we're working with families with special needs children. So we had to start inside first. And so I had to go to my board of directors and have a conversation around whatever we're going to do in the community, we need to do with the staff first and foremost. So even as we had to socially distance and we worked from home for many months, that began to have an adverse impact on some of the staff who said, I need to be in the building. And so then we needed to figure out how do we do that for the person that needs to be there while saying to the other staff, you can't go there. And so all of that had to get worked out, but we've been able to successfully do it. And some months later, and looking back at it, the staff have said it's been helpful for them, as well as the families. Like in the past, we've not been able to use DCF funds, Department of Children and Families funds, to feed the families, if you will, in terms of giving them direct money. But they loosened those restrictions. And as a result, we provided about $5,000 in gift cards to families on a weekly basis of $100 cards per week. And we monitor that. But that was to reduce the food insecurity, because all of these have an adverse impact on the health of the families that we're servicing, particularly Black and brown and poor people.
Thank you so much for sharing that. One of the things I'm very curious about is what are some of the things that were put in place to just create a very safe environment for your staff that said, I have to come in, I want to serve, in light of COVID-19 protocols. And also I'm very curious about the when we're talking about food insecurity, about the gift cards. And that's really and $5,000 in terms of gift cards and providing that. You said it was weekly, no? And
yes.
Weekly to populations in desperate need. So just wanted to ask those two quick follow-up questions. Would you be able to share a little bit more on those?
Sure. So in terms of the staff, we create a wellness team, which includes one social worker and another staff who's actually a supervisor. And their job is to check in at least once a day, sometimes twice a day, with all of the workers to see what their needs are. And essentially, I serve a perfunctory role in that whatever they're requesting, I just need to make sure that it's legal and it's within the scope of our mission and what the board of directors expect. But we made a lot of adjustments in that regard. So we accommodated, we staggered their hours, we staggered their requirements. Some come in all the time, some come in none of the time. Everyone gets paid. Right. And even for staff that was struggling emotionally, what we did was we reduced their family load. And because of our beautiful relationship with Rutgers University, we had college interns who could then step in and work under supervision with a social worker and take on some of those families. So we were successful in reducing the family load for the staff that was struggling. Give the Rutgers students greater opportunity to work hands-on and then be supervised by two supervisors rather than one. But that helped us to alleviate some of the challenge. And the other thing around the food insecurity, so what we did was we gave them a $100 gift card each week. and we made sure that we picked a supermarket that was closest to the populations that we were servicing, so that they would not have transportation as an issue. And if we identified those kinds of issues, then we partnered with the care management organization, who are our sister agency, and they would make sure the transportation was covered. And then after we did 4 weeks with a family, the care management organization picked up another 4 weeks out of their flex fund budget.
Wow. I mean, just a lot of creative, strategic strategies, interventions for clients, for staff, for student interns. I think creativity, ingenuity comes in when we're in the midst of a crisis on a leadership level, and just travels down throughout the whole system. And I just want to open it up for any other panelists. Please talk and share with us about how would you describe the effects of the two pandemics, the twin pandemics, upon your organization, your clients?
So I can speak on behalf of Hyacinth
Good
Foundation.
morning.
Morning, everyone. And organization that helps people living with HIV, and also a very large prevention program to keep people from contracting HIV or being exposed to HIV. So we started working with our staff first, because everybody went on quarantine back in March and realized that our staff did not have the equipment to even work from home. So we got a very large grant, and we applied for COVID features, and had to purchase everyone laptops, Chromebooks, smartphones, and realized that even our own staff did not have the means to be able to work from home, because many of our approximately 80% of our staff are persons of color, and so they also face the same struggles as anybody else, and many times they live in poorer communities as well amongst the staff. Amongst the clients that we serve, because they are also part of the community, and which is one of the reasons why we hire them, because they are peers. So realizing that our staff didn't even have the means was one of our first steps to get everyone the devices that they needed to even use. We also had to look at, again, same thing, food insecurities with our clients. Again, we also did the gift cards, the ShopRite gift cards, most or whatever grocery stores they were closest to, as well, and found that was very helpful. Many of our clients became homeless during the pandemic, so we had to get hotel vouchers to be able to house them and make sure they weren't on the streets or in situations where they were among a lot of people who could have the potential to being exposed to COVID-19. So making sure that everyone also had housing issues resolved. And also not only just the clients, we found out during the process, because many of our staff live in some of the more socioeconomic lower areas, that they needed housing for themselves, and realized that quarantining was actually a luxury, that everyone did not have the privilege to quarantine because of their living situations. Many people, we found out, staff and clients, are in situations where they may be living in a 1-bedroom apartment with 6, 7, 8, 9 people. So someone would literally be in the corner with COVID-19 in the living room. Two other people would be in another bedroom. One person would be in the dining room, say, for example, sleeping on a pallet on the floor with COVID-19. So it's really difficult to quarantine from 2 people, and you're in a house of 8 people. So even trying to find places for them to go in the middle of the whole pandemic. So it was really looking at 2 things at the same time, right? Black and brown people, which who we hire, as well as the Black and brown people that are our clients, and all of them being in a socioeconomic state that's generally a little lower than expected. And when you think of you hiring a worker.
Thank you for sharing, because I definitely think that from what you're communicating to us is that interventions, I guess, had to be implemented equally across the whole system of clients, staff, right?
Correct.
I know one of the things that my colleague and I are working on right now is just a conversation about families, nuclear families, extended families, multi-generational families. And one thing that it tends to be a familiar theme is with Black and brown families. They tend to interact with, various members of their extended family, multi-generational. And that is not unusual, it's not uncommon, it's a normative okay? And even for immigrants, where you are living and residing with family members, and what might be a definition of extension might be different. What does extended family mean? And so when it comes to quarantining, whether it's a client or a staff member, you just naturally are living with your grandmother or your great aunt or your cousin or your nephew. And so as a leader of the organization, it sounds like you had to really tap in and dig deep about creativity of how to work with both, right?
Correct. And so we also provided clinical supervision as well as mental health services for clients and for our staff. And we continue that till today, actually, that staff are sent a Zoom link to be able to join a clinical supervision throughout the whole process and have the space where they can talk about their own issues.
Excellent. And I think that also sharing about the fact that staff needed support, they needed interventions as well, is critical, because it's important for our students to hear that it's not just about serving clients, it's about also looking to see what's needed, on the professional level, because a pandemic transcends race, it transcends age, socioeconomic status, it transcends health. It touches upon all aspects of life, right? So critical. Thank you so much, Rosalind. Are there, what you shared was so powerful. Are there other panelists that just want to talk about any of those areas, or something that's unique and different that's been brought out from the pandemics, the twin pandemics, in your environment? Share with us what's happening.
Yes, so, no, please go ahead.
Okay. Well, we have a slightly different perspective here at Volunteers of America, because we run residential programs. So where others may have had the opportunity to work from home and go remote, we didn't. All of our programs, we stayed on 100%, and our staff, they were champions. They stayed on as well, because we run homeless shelters and housing programs, as well as reentry service programs, where our staff and our residents are in halfway houses. So we didn't have the opportunity to kind of shift and rotate in and out. And so we always have universal precaution plans in place for crisis situations, but we never had anything as globally vast as a pandemic plan. So where we thought we were very prepared, this situation really let us know where we had to act very fast and bring a lot of things in-house. So we had to really amp up our meal service plans, our services plans for our clients, and still do it in a way where we were following the CDC and the World Health Organization's guidelines. And how do you do that when your population isn't reducing, so to speak? Because when they're saying to practice these 6 feet social distancing guidelines, unless your population is reducing, that's virtually impossible. Now, as time went on, that was able to happen, but we had to put ourselves in a position where in the beginning, it was very tough, and it was a lot of unknown day to day, but we put together these preparedness plans, and we trained the staff. Education was really, really important in the beginning. And so what we really, praised ourselves on was ensuring that everyone received all of the information live time, real time, and that no one was sent away without having, like a debriefing. So every day there were meetings. We did do things as remotely as we could. So we would be in the same offices, so to speak, but we would still, talk on the phone, if versus being in the same room, or we would do virtual meetings this way, just to kind of keep people as safe as possible. And then, being an organization that we can, we're mid-level, so we have about 500 employees if we're fully staffed. We did have some situations where the staff did start to decrease because people had to stay home and take care of their children and other family members who became ill. And we found ourselves to be in a situation where we were struggling to keep the staffing on board, but people were real troopers and they were working extra hours and extra shifts. And so we had to be very creative with how we incentivize them to keep them really motivated to stick around and support our clients that otherwise would have nowhere else to go because they were homeless, or they were in a situation where they could not be released to
Yes.
go home. And making sure everyone was fed and clothed and the lights stayed on. That was really important to us because we didn't want there to be a breach or break in our services. We wanted things to still be as normal as possible and still provide the same continuity of care.
Wow. So you touched on, I think, the uniqueness of the environment that you're in and how you guys had to create parameters, create, policies, really re-examine the space you're in, how to keep everyone safe, clients, staff, different things that you can do to kind of work with staff morale, a lot of important critical pieces. And it sounds like, not only does it sound complicated, but what is also clear is your commitment to navigating this difficult space. And thank you so much for sharing. Thank you so much for tapping into that. Is there any other, someone else on our panel? Thank you so much, Tamika, that wants to share. I see Charles would like to share as well. Just share with us what's happening at your agency and how is the organization being affected by these two pandemics? I just want to quickly unmute yourself and we'll be able to hear you.
Can you hear me now?
Good morning. Good morning.
Good morning. So at the Fletcher House, it's a residential community corrections program. And the Department of Corrections put policies in place where all of our residents immediately lost visitation privileges, lost visitation rights. We had to come up with alternative plans, providing postage stamps, telephone calls to family directly. Not having that contact, being able to see family members really heightened the anxiety amongst a population of men who were already fearful for themselves. And as a work release program, working and being able to provide for their families was critical to their program success. In order to stay in the Fletcher House, you have to be employed full-time or in a full-time vocational educational program. All of those things were terminated. The men could no longer go to school. They could no longer participate in vocational training. They could no longer go to work. Even those individuals who had what we call essential jobs, they were also kept from going to work. The motivation in the house became very, very low. It was almost like putting men back in isolation, even though existing in the community, they were subjected to the same conditions that an incarcerated person behind the wall would be experiencing. The fear associated with COVID-19, whether or not the person sleeping in the room with them, it was impossible for us to practice the social distancing in a house with 80 men and each to a room, some rooms having 6 to 10 people in it. there was a lot of anxiety that we had to really intervene on a daily, hourly basis, trying to make sure that men felt safe in our environment. We had to make sure that we were taking temperatures. We implemented the CDC protocols, temperatures on a daily basis, documenting the temperatures, triaging men with the state hospitals that had elevated temperatures or any cold or flu symptoms, educating our staff into how to do those things, how to express the empathy necessary, and understanding the individuals who presented with high levels of anxiety around this COVID. And then the staff themselves, paying attention to them as well as to our clients, because our staff presented with some of the very same issues. Anxiety around taking something home to their families. Tamika talked about not being able to work from home as a residential facility, and they had to come to work. And those that felt sick or ill were sent home. We always tell individuals, if you feel ill, don't come to work. You will be paid for that. But then we had to really pull our resources and have coverage 24 hours. And so there was no person exempt from coming in to do whatever job needed to be done. And we're still doing that. Some staff left because of their own issues around COVID. And some just said, the environment is not safe enough for me to be in. You have too many people, you're gonna start having visitors come back in. And we really had to sit and come up with a plan of how we can have visits, how we can connect these men back to their families, where they can at least see, sit, and talk with them face to face. We had to develop a plan for the Department of Corrections to find acceptable, where we can have visits outside as opposed to inside, where we had to structure policies around the visit program that adhered to the CDC recommendations, Department of Health protocols, whereas men could visit their children, their family members, and still have social distancing, be outside where you're not coming inside, where we have 80 other men in the building. And so we really had to be creative in how we can reconnect people with their loved ones.
Absolutely.
And so you still had the financial issues. It's just everything coming together at one time. Not just the pandemic, the economic struggles that families are facing, men not working anymore to be able to help support their families. Then you have people who had cases pending against them. Domestic violence counseling was required for those individuals, and the counseling services were no longer provided because places closed down, and that impacted when people would be going home. We also had to create a system where we can start releasing people. The state of New Jersey passed a bill where most of our clients were expecting to be able to be released because, for the most part, they're nonviolent offenders.
Yes.
And that impacted the overall population that we serve. We weren't getting any clients for the most part during the pandemic. Clients were leaving, but none was able to come in because people were stuck where they were. If you were in prison, you were stuck in prison. Your status may have changed, but you couldn't move.
It sounds like there was a convergence of a number of issues, multidimensional at your agency. You're tapping into a number of different types of populations. And so there's a natural overflow of issues that bleed into so many different areas, right? So many different areas. I think
there's a convergence.
There's a convergence. There's a convergence there, for sure, for sure. Thank you so much for sharing. Thank you so much for sharing. We are going to transition to our second question because we're only at the first. Can you believe it? We're only at the first question, and we have so much to cover. But lastly, I just want to just quickly just connect with Melissa Chalker. Just want to hear from Melissa Chalker about her agency before we transition. And because we have 9 panelists, and these are just 2 areas, two pandemics are just rich. I just ask you guys just to, to definitely connect and share with us about what's going on, and we'll try to guide you as much as we can regarding the time that we have left. But thank you so much. Melissa, talk to us. What's happening at your agency?
Thank you, Renee. Thank you so much. I really appreciate that. I did just want to sort of piggyback on what you just said about, sort of the convergence of so many different things here, because as all of my colleagues were talking and all of the wonderful information they shared, I just kept thinking every single one of their service sectors includes older adults, right? Whether it's their staff, whether it's their consumers, the clients they serve, or family members of both of those populations, right? Of their staff and of their clients. We know from the media that the older adult population has been greatly affected by the COVID pandemic in particular, because oftentimes people of older age are greater at risk of becoming seriously ill from COVID or dying from COVID because of other health risk factors and things happening in there. And we know additionally that we've been hearing a lot of attention has been being paid to the risks of social isolation for that population, as other populations, younger populations, have experienced social isolation for the first time and can relate to what's happening, what usually happens to older adults if they are isolated from their family and community. But the other thing that I want to make stress here is that when we think about the economic insecurity that's been caused and this other pandemic of structural inequality and racism, we have to remember that older adults aren't immune to that either. In fact, the Census Bureau did a recent pulse survey, and they actually found that 43% of people over 65 reported a loss of income from employment in September. And like all of my colleagues that have already told you that food insecurity was an issue during this time, the county offices on aging that serve the older adult population, they received a 5,000% increase in calls for emergency food assistance during this time. And what's really important to point out is there are a lot of people over 65 that are still working, and oftentimes they are people of color who didn't have opportunity to save money, and because of the structural racism has caused a wealth gap in our country. These are people that need to work longer and might be working jobs where they're exposed to COVID because they're in retail settings, in grocery stores, pharmacies, and these places, and even in the healthcare facilities. Whether it's a nursing facility or a nursing home, they're nurses, they're janitors, they're their support staff in these settings, and so they're not only at risk of getting COVID, but they're also at great financial risk for, if they lose work or if they've lost work. And so, yeah, we have to remember, yes, I saw Lauren's comment about direct care workers. Direct care workers, are of all ages, of all ethnicities and races, and we can't forget that they are low wage earners and that this has had a great impact on them. So.
Thank you so much for sharing, because one of the things that stood out, I think, is really where, older populations are in terms of some of them are still actively working. And so, they are a high risk population, and navigating that space where they may not have the luxury to stay home and work from home. Right. And so being in a space where they're incredibly at risk to contracting COVID-19 and all of these socioeconomic issues that come into play with this specific population, what is happening with them and how it kind of intersects in all aspects of their life. Right. I mean, just so important, so critical. But so much to cover. Thank you so much for what you guys were sharing just about question 1. And we're going to transition back to Mark Lamar.
I'm going to take it for 1 minute and then ask Bernardo if he'd read our next question, which is we've already begun to uncover a little bit. And I'm going to ask Bernardo too, so we, in the interest of making sure we hear from all of our talented and expert panel members, that Bernardo call on someone. So it'll be like Hollywood Squares. Just call when you're named, okay? So Bernardo, would you read the next question and engage with our panel for a few minutes on this? This would be wonderful. Bernardo, you're still muted. Come on off.
So again, I just want to thank everybody for being part of this event. So the next question here is, what have you observed to be the intersectional effect of these pandemics? So Gena, would you mind starting us off with that?
Thank you, Bernardo.
We know that there's a lot of things that each of you have been talking about, with Charles talking about policies. We're talking about a lot of homelessness issues. I like Renee's, I think Renee, you have mentioned something here, the intersectionality of structural racism and systemic poverty that plays out in many aspects of someone's life. And so we know that there's been a lot of issues related to this and how this is affecting people of color. So.
Yeah, well, what stands out to me is someone said it earlier too, this feeling of being stuck, within the structural inequality, within the pandemic, the quarantine. There is this feeling of stuckness, of where do I go from here, of despondency, of fear and anger. And as our colleagues have said, it ranges from our clients throughout our staff and throughout leadership. And so I think that a deeper listening was very, very necessary in our agency. Our JAIA stands for Just As I Am Youth Empowerment. We are in the business of building conscious leaders. And I also work for the New York City Alliance Against Sexual Assault, and I also manage their youth programming. And so working with youth and families who were affected by both pandemics caused us to really take a pause, because we too are from that community. And so it affected all of us. So it really was about taking a pause, getting more, asking more questions, really not assuming. I think there was a sense of urgency that happened for everyone. Oh, we got to do something. Oh, and this need to act without really finding out what people need, what our staff needed, what the youth needed. And to be honest, it was between the two pandemics, couldn't tell which one was worse, right? But the youth definitely experienced that sense of being pushed back, held back. And we did a lot of surveys, we did a lot of focus groups, we did a lot of conversations just to find out, just to give them a place to express themselves, give them a place to, and for the whole team as well. JAIA is a small team, and we have very hands-on board members and everything. So we were all in on just checking in more regularly with each other, listening more, slowing down, definitely slowing down. I think it just goes across everything is this feeling of hurry up and wait, hurry up and wait. The checks are coming in the mail, but then you have to wait. It's like it was this you want to address the food insecurity, but then you go to these to show up and you have to wait, and you have to. For the youth, it was very frustrating because they themselves didn't have permission to go out and do the things that they want to do. They didn't even have permission to. For some of them, for example, we were working with a LGBT group of youth, and we put all the programs online, and we was like, okay, let's continue this work. But they weren't safe at home to talk about their sexuality at home. And other young people, some of our youth leaders weren't safe at home to even, conduct business as usual with going to school or having our group meetings. There was a lot of things that were just put on hold. And I think the anger that was also happening, because now people are out there protesting and they can't go and protest, and so it's like, what do you do with all this pent up energy? And I think that was something that we really spent a lot of time working on, with just reminding ourselves it was okay to slow down and deal with also this urgency to, to do, and instead just really see how, how focus on the being, how are you being right now? And that's kind of, to me, was across the board for both pandemics. How do I show up today? How am I checking in on myself? How am I, because JAIA is all about personal development before leadership. Know who you are, know what your strengths are, know what your triggers are. So it really actually gave us an opportunity to really walk our talk. Yeah.
Thank you, Gena. I think it's important. I think you took that perspective, and how do you take that energy, that anger, that frustration, and be able to, how do you focus that in a way that's constructive and helpful in these moments where we feel so overwhelmed, so super anxious, and can feel like, what are we going to do here? What's our course of action? And in a moment where we feel there's so much, racism, oppression, and things that are going on that are really impacting people. Renee, you had put in the chat about the structural racism comment. Did you want to say a little bit more about that?
Sure, thanks. So I wanted to offer kind of like a more high level overview of how these twin pandemics have played out in our state, and hopefully others can, jump in on how that looks on for people, all over the state and that you're working with. But before the pandemic, the number of households unable to meet basic needs already, despite working, rose 41% between 2007 and 2018 to 37% of New Jersey households. So more than a third of everyone in our state, and nearing two out of 5 New Jerseyans struggling, right? It's a huge number, while official poverty numbers remained flat at 10% during the same time. So for both categories of poor and working poor, Alice households, as the United Way of Northern New Jersey frames it, Black and brown people are disproportionately impacted, with 52% of Black and Latinos struggling to make ends meet in our state. In addition, since the enactment of TANF in 1996 and its punitive policies, for the most part, towards families in deep poverty, New Jersey has reduced the number of families eligible for this critical assistance by 91%. And so these impacts are a result, as we talked about, structural racism, including vulnerabilities resulting from inadequate housing, limited access to nutritious food, and low-wage jobs, starting with stagnant wages since the early 1970s that have not kept pace with inflation and the cost of living. And certainly that number of the disparity increasing, the inequalities increasing between 2007 and 2018 is a direct result of more low-wage jobs rather than mid and high-wage jobs in our state since the Great Recession. As my amazing fellow panels have already shared, these racial and economic inequities have only expanded during the pandemic and have included much higher rates of COVID infection, hospitalization, and death for people of color. Black and Latino residents are more than 3 times as likely to contract the virus and almost 2 times as likely to die from it. In addition, most immigrant families are of mixed status, meaning a combination of documented and undocumented family members. However, these families have largely been left out of most stimulus programs and funding. So all of these families are struggling with reduced hours or lost jobs. And except for a little bit of stimulus money that some families of color may have gotten, they won't get that income that they've lost over this time of the last 8.5 months back, right? And won't get back to where they were for some time, and where they were was not so great, right? So we do not need to build back, but build differently to get to a better place that recognizes the dignity and worth of every human being in our state. But I also wanted to add one other quick thing that I don't think anybody has mentioned yet. We're already seeing significant spikes in suicides and overdoses, especially in certain counties where disparities were more prevalent. So just wanted to raise that as another critical issue that we need to be looking at.
Thank you, Renee. I appreciate it. Susan, wanted to bring you into the conversation.
Sure. Thank you. Womanspace is an agency that works with victims and survivors of domestic violence and sexual violence. And unfortunately, domestic violence is an equal opportunity crime. So the people that we serve across the board, they sort of span a wide range from, socioeconomic backgrounds, racial and ethnic backgrounds. And one of the things that we saw was while what remains common and true is that isolation is a tactic used by abusers. The pandemic, the COVID pandemic, served to just exacerbate that problem for all of the clients that we served. Because now, where for most people, if they had a home was a safe place, this became even more a dangerous place for them. Where the sort of the curtain was drawn back was how the pandemic affected those who did not have access to a steady job, a home where they could safely isolate, or whether they had access to technology or other services. Because often then the choice was, do I go to my job to earn a minimum wage, or do I stay home and help my children, participate in school? Do I even have the technology to be able to help my children access what they need to be able to participate in school? If they were reaching out to services for us, could they do that from their home? In most cases, they couldn't. And here's where I really think you see the creativity and the ingenuity of people, and that gives me hope that even in the midst of like really truly terrible times, people could step up and say, here's how I can make something happen because I need it so desperately. And social connection, I always say this, healing cannot take place in isolation. We need one another as a community. And this is a time that we can come together. And I saw people come together, beginning with even just our team. One of the questions that we had asked up, let me go back. I still remember March 13th, when I don't know how the rest of you were, but we sort of naively thought we're going to close down for maybe a week, and then we're going to come back. And when we closed down, we contacted all of our clients and they said, oh, that's fine. 1 week, we'll be okay. We don't need to have our counseling sessions. But 1 week became 2 weeks and it became phone calls. But then safety and confidentiality is prime in the work that we do. How do we do a 360-degree turnaround when all of the work we did was in person in our counseling office to now you have to do this remotely? How do we communicate without putting our clients in danger? It really was, it felt like the weight of the world on your shoulders because these were people's lives that you were concerned about. How do you manage that? But with our team, beginning with asking each of our individuals, at Womanspace at least, it wasn't a top-down, people telling us what we needed to do. It was bottom-up. What is it that our clients need? And then asking all of our staff, what is it that you think that you can do to do your work well? What is it that you think the team needs to do so that we can all do our work well? And then finally, we said, what is it that you need the agency to do so that we can do our work well? And because it was such a team effort of everybody coming together and putting our heads together, because I don't think any one person could have figured it out by ourselves. Everybody felt safe in the policies that we had to put in place, because it wasn't a question of just saying, well, make a phone call, or we can use Zoom. Because Zoom, while it might be HIPAA compliant, the Zoom professional, it's not WAWA compliant. And at our agency, everything needed to be both HIPAA and WAWA compliant. How do we manage to keep our clients safe, as well as do the things that are required by, structures and governments and policies that say, you still need to get informed consent. You still need to have all of these in place before you can do your work. And it was sort of navigating. And I think for social workers, I really do believe, going back to our principles of social work, that we, hold on to, that we honor the worth and dignity of people. We stay within our level of competence, that we are always keeping service as our prime sort of focus, really does help us in times like this to make informed and the best decisions that we possibly can, with humility, knowing that we have to pivot. At times, you are always going to have to pivot.
Thank you, Susan. I really appreciate how you've communicated the challenges that some of the clients that go to Womanspace, and those barriers and disadvantages that they're experiencing in order to get the supports that they need to get through these tough times. I know that maybe I just wanted to invite one more person to comment on this question before we move on to the third question. Was there anybody else from the panelists that would like to contribute to this question?
All right. Excuse me, hearing none, maybe we'll move on to our third question and ask Jose Cruz if he'd share the question, and we can re-engage with on this last matter. Thank you.
Great, thank you very much. Good morning. Thank you for joining us. So question number 3 is, what tactic or strategies has your organization used, planned, or envisioned to manage through these pandemic times? Also on the chat box, I'm just gonna share with you just some things to keep in mind as you're looking at this question. So feel free to include strategies regarding self-care, that the message that is sent out to staff and students around that is very important, obviously, as we navigate this pandemic. Response efforts with partner agencies. I think that's a big issue in terms of seeing if there's consistency throughout the landscape of different organizations. And if there are new approaches that have worked well and probably will continue in your agency after this public health crisis. So as you think about that question, please feel free to include some of that information. So I was wondering if Lorianne, you would be able to kind of start us off maybe with some of your thoughts around this.
All right, so I'm at Crossroads Programs. We service about 120 youth, actually from in utero to 21 years of age. So when the pandemic hit us, it was, how do we create a safe environment and get the kids to buy into the fact that they're not going to be able to go anywhere and they have to shelter in place. So the use of the virtual platform for our clinical staff to be able to communicate with the youth became the strong suit for the programs. I have to give it to our clinicians. They were very creative and engaging. They would drop off different items for groups. The youth support workers would help facilitate, and then they would do Zoom groups. They were doing individual sessions as well as family sessions. So I believe the virtual platform is something that is going to remain a constant at Crossroads as far as clinical support to our youth and their families. Right now, we are once again looking at probably not being able to allow the youth to leave the facilities due to DCF guidance, which has really come back around to say that, you know, leaving the facilities puts them at risk for COVID. So we're having those challenging conversations with the youth and the families. And once again, we're really leaning on our virtual platforms to get us by and get us through. It actually worked in our favor. I have to say we had very few cases of COVID. I know with the second wave, we're keeping our fingers crossed, but really approaching the, you know, shelter in place and really providing the clinical services virtually has really helped to sustain the programs.
Excellent, thank you. It's a lot of new and different type of responsibilities that, again, kind of makes you think, how do you spread yourself that way? How do you begin to adopt these new ways of engaging, and also think about the accessibility of clients and patients around some of the platforms or some of the new strategies we're implementing?
Yeah, we also, I have to think back to some of our more fun and engaging. We did family sessions that did family sing-alongs. I'm not a singer, but I was singing with the families, to help them engage with their youth. We did water ice making and ice cream making with one mom who cooking is her strong suit. So we all got around the screen and we made ice cream with Melanie. So we kind of embraced this new reality with all we had.
Wonderful. Wonderful. Thank you.
You're welcome.
Thank you. Any other thoughts?
Sure. At the Family Support Organization, we did a variety of things, some of which I've mentioned. But relative to self-care, in addition to the wellness teams, every Friday we have a 1-hour check-in. So that's for staff, interns, support staff, and any of our volunteers. And we talk about everything except work. So it's around how you're feeling, what's your temperature, is there something we can support you with, or do we need to go offline and provide that support? So they look forward to that. And that was something that the staff and students requested that we continue. So we continued it. Additionally, we modified the work schedule because I also have interns who are pregnant. And so the concern around that was, how are they going to be able to do the internship and manage the pregnancy? And so we adjusted the work schedule for all of the staff, which included the interns. And so, for example, we have an adjustment for staff with small children versus those who have no children. And how do we have that conversation and be fair and equitable? So the only way to do that is to have it openly with everyone and include everyone's voice, so that those without children understood that they weren't being treated differently. It's just that they didn't have the same need as the two people with the smaller children. And so we gave everyone Fridays working from remotes on Fridays, and we then had to be creative to work with the interns. So we connected them to another agency in the FSO world that I'm also the director in, so that they wouldn't lose their hours. So they were able to work with me there and still do the same work. And then greater communication with the board of directors, because normally it's a once a month meeting, but now we were talking with them weekly and checking in and adjusting my leadership thinking from traditional training to that which is outside the box, in a community policing model in which we're dealing with problems as they occur and we're solving them collectively. And then finally, utilizing technology more effectively, as some of my colleagues have mentioned, making sure that everyone has the equipment to do what they need to do. And we had to find the resources because initially it wasn't in the budget. So we simply got the board to trust us to spend $9,000. And luckily the state reimbursed us down the road. But my position was, this is what we need to do right now, and we'll figure it out later with the state. And so it worked out, but we have to be outside the box in our thinking.
That's right. And I think that's really important. I mean, when we engage with students, we ask a lot of the time, how would you think out of the box? What are some things that you can start to think about to navigate this issue? And right now we're having that experience where we do have to be creative and kind of think of different strategies that even our clients are asking for our patients. So excellent.
Yeah, I wanted to add, focusing on our youth leaders, we sent self-care packages, journals, art materials, and stuff that we would have used in our workshops anyway. We decided to at least focus on the youth councils and the leaders, the facilitators that would have been going out and doing workshops with their peers. We focused on sending them packages for self-care. As well, we've been fortunate to come across free trainings for facilitating online. So that was helpful to us, because as we were learning, we just brought our youth leaders into those trainings too, and we learned together. We got to practice with new apps and new things together, and kind of just made it like a fun thing to do, just a fun learning time together. And also as well, just that downtime, more check-ins, more individual check-ins with the youth, encouraging them to check in together, things like that. I want to add.
Excellent. This is great. Anyone else who has not spoken or would like to share a little bit more about what they're doing?
I think one of the things we've done is also not so much reintroduce our trainings that we've done throughout the years, our trauma trainings, our wellness trainings, our training that we've done with Dr. Howard Benjamin for the wellness community at Hyacinth. We're looking at people's unwanted aloneness. So we're looking at people's loss of hope, and we're looking at how people have a loss of control. And it's not just our clients, it was all of us, like all of us are living with this. So kind of like the theme of the whole self-care and making sure we're bringing that back. You know, what is your feelings thermometer like today? Like to really start to begin to use the words of the trauma that we're all experiencing, and kind of doing a check-in with not only our staff every day, but also with our clients as well. We're just kind of reintroducing all of the trainings we've had over the years.
Yeah.
A couple of things that we did at Womanspace was we did a book club online. It wasn't an easy book because we read How to Be an Anti-Racist, but we did it in a small group. And that was also our way of self-examining and sort of, kind of keeping ourselves conscious of what did we still need to learn and who were we as an agency and how were we perpetuating or being anti-racist in the work that we did. And because we did it in a small group, it was really, really helpful that people could have, heartfelt conversations. Mm-hmm. The other thing that the agency was very supportive of our staff was in making sure that we were able to get all the CEUs that we needed to get our licensing in place. Rutgers was helpful in that because there were lots of online, digital seminars. There were other, so we did it almost as a group together because we would sign up for things together, or we would sign up or buy a digital seminar and then watch it and then discuss it with one another. So I think for staff feeling that, the agency cared and wanted to make sure that they were getting what they needed in this time, that it wasn't just all about, looking beyond ourselves, but also looking at ourselves. That was helpful.
Excellent, excellent. And Charles, you had your hand up just a little bit before you. Oh, you're muted, Charles. Thank you so much. This is great.
Okay.
Mm-hmm.
So what I was going to say is that what we've started doing is having those conversations with staff and residents in our program about collective responsibility, one for the other. When you're taking good care of yourself, you're also taking good care of everybody else. And wearing of a mask isn't a political statement, it's a healthy statement. And so we want everyone in our programs and that work at the Fletcher House and throughout our agency to not just be concerned about yourself as an individual, but the collective whole, all of the clients, all of the staff, and really trying to amplify that message that we are in fact our brother's keepers. And we wear the mask, not for me, but for you. And making sure that that message resonates and is amplified every single day. And also ensuring that the services are available for people when they need them, when they want them, connecting people to the resources either throughout our organization or outside to other community-based resources. And so I think as long as we view our responsibility as a collective responsibility, we're going to get to the other side of this pandemic.
Excellent. That's great. Thank you. Thank you very much. Any other thoughts, comments?
I think Renee has a question, Jose.
Okay. Yes.
So I don't have a question, but I think Tamika also raised her hand, so let her go first.
Okay.
Well, I'm pretty sure, like most people, 2020 was a big year for everyone. For us in our homeless services division at Volunteers of America, we were planning our strategic plan. We were going to be renewing funding. We were going to be doing a lot of things. And when it initially hit in March, we were forced to, go out on a blackout period. So when everything opened back up for our clients, we made, when our houses opened back up and everybody wasn't on lockdown, we made it a very big point of ensuring that we focused on education, not just for the clients, but also for the staff. And since we had to be on so many different Zoom meetings, it seemed as if we were always on a meeting every 5 minutes. We used that time to connect with our partners in the community to ensure that when we were meeting, it was for a purpose. And so during that time, whatever issues everyone was experiencing in-house, we use that time to help one another. So whatever consortiums we were on or community cease meetings or committees we were on, we use that time to help support each other and share resources. So that was very big within, our provider agency links. And we were able to apply for a lot of different grants, but we did that very strategically. We just didn't apply for funds just because it was available. We applied for funds that were really going to help support our agency's mission and needs and goals, because we didn't want to just have money sitting around that wasn't going to be used. If it wasn't going to be helpful to us, then we shared that resource with someone else. Because why take the pot of money to then just have it sit to then give back to the state or the federal government for it to disappear and no one knows where it was going to go. We also were able to, because I know in the beginning, people probably couldn't get PPE equipment and couldn't get the resources that they need. But whenever we got information on things, we shared that information with other providers to ensure that everyone was able to share the wealth. So that was very important to us. And we, as a part of our preparedness plan in our facilities, we have not been allowing outsiders in to just, limit the number of individuals in our facilities. However, we do allow our student interns to come in because that still is very important to us. But we do consider that as a part of our education piece. And when our students are there, we make that a very big point to have that focus on, the self-care needs and for our clients and our staff, because that also gives individuals respite. We consider that a part of the respite because the staff are able to then ensure that they get their breaks in and that someone else is able to then support the clients in a different way. And it gives a learning opportunity to the students as well, because they're able to learn more about the population. And the advocacy piece, we really focused on that because we saw during this time that where in the beginning, there was not like a big push for COVID testing among the homeless population, which was very, mind-boggling to many of us in the field. But when it did become, very important to the communities, because homeless individuals are still wandering the streets, it was not very important to families. They didn't have quarantine sites for families. They didn't have plans for families. They didn't have plans for children. Or if their parents tested positive, what was going to happen for children of parents that tested positive? Would they put them in motels? What would they do with their virtual learning? How would they still support these children's education? So we have been, really forging through and advocating to ensure that these children still receive the same continuity of care and support and needs, no matter where they're residing, whether that's a motel or they're still residing with us in the shelters. So we just, wanted to, ensure that across all provider meetings that we're a part of, that we just ensure that everyone is aware and that we support them and that they can call us and that we're always, a face, an agency as well.
Excellent. Thank you. Thank you very much.
I just wanted to
Oh,
quickly talk about some of the kind of state level or macro level policies that have been implemented during this time that really should be looked at for long term and should have been looked at before this to help make access to these programs a little easier. So certainly we've seen for safety net programs in New Jersey, presumption of eligibility rather than going through the full application process initially, relaxed application procedures, delayed recertifications, in addition to, just increasing SNAP benefits to the maximum benefits over the last few months, and the pandemic food assistance program that helped families with school-age children who were eligible for free and reduced price meals. But we also worked with partners, healthcare advocates, to expand access to free testing and health coverage throughout the state, and especially a little known program called the Emergency Medicaid Program, which really should be expanded to include a pandemic as an urgent need, where that program is made available to more people, especially for those people who didn't have insurance or a doctor prior to their diagnosis. We also worked with advocates on housing moratoriums, as well as the expanded and extended utility shutoff moratorium that Governor Murphy signed on October 15th, which mandates that no household may have its electricity, gas, or water regulated or unregulated, meaning if it's a private or municipal water service, through March 15th, which is the standard period for the winter moratorium. And if anybody has had a disconnection during the last 8.5 months, that should be restored immediately without any fees to the family, among other things. So there are just so many great things that have happened in this emergency situation that really should be looked at to really help lift people who've been struggling for so long to get where they need to be going forward in the future.
Renee, thank you so much for that summary about what's happening on a macro basis, and it pulls together sort of a collective look at what should have been happening, how we should behave as a society sort of anyway, but where we found ourselves going. Didn't happen on its own. It was a lot of advocacy that made these things occur. And I think I'm going to thank Jose, Renee, and Bernardo for posing the first few questions. And I just would like to ask this of the group as we get toward the end of our time together today. We have the idea of next steps, really. I just will be sending a summary to everybody about the poetry that I heard coming out in your responses today. I think about this all the time with all the hard things we write about and hear about. There was poetry in almost every remark. So I'm going to be summarizing that and sending that back. But what we'd really like to spend a few more minutes on is asking about next steps. And we'd like to ask, how can we at the School of Social Work partner with you most helpfully with your respective organizations? We're in the process of creating action steps for our recently adopted strategic plan at the school, and have identified our community partnerships as those enduring rich areas of need and opportunity. So in addition to our placing students with you to intern, while you in response and reciprocity deliver the essential field education they require, what else can we extend research, policy, training, or subject area expertise that would support the work of your organizations? What else can the School of Social Work help your organizations do? How can we support you?
Mark, I have a really simple request of everyone on today's call, as well as, for the Rutgers School of Social Work to help us champion, as I've already mentioned, the risk and dangers of social isolation for our older adults. We know that it's also been an issue for young people, for college students, and as Renee pointed out, the increase in suicide and overdoses during this pandemic. And as we really think about the language we use, if I could ask you all to start saying physical distancing instead of social distancing, because we can stand 6 feet apart from each other and wear a mask and still remain socially connected. And we as social workers know how important those interpersonal relationships are, and how much it's to be seen and heard and understood by our community is important. So if you could, wear your mask, wash your hands, and stay a safe physical distance from each other, but remain socially connected, I'd really appreciate it.
Well said. Thank you. I said there was poetry all through this. So yet again, thank you. I When the pandemic ends, I'm getting another tattoo, and that may be it. I don't know.
Well, I was thinking of T-shirts, but that's a permanent solution. Yeah.
Beautiful. Thank you. Just beautiful. Thank you. But how can the school be of assistance? I know we have a deep reciprocity with all of you. We send you the students who you then graciously and professionally train and teach and nurture and mentor. So we've got that figured out most times, most days pretty well. But what else can we do? We so feel gratitude for all of our community partners and the work you're doing. As you described, the not having the option to not be where you were. Susan talks about pulling back that curtain, and what do we see? We'd like to know, and again, it doesn't have to end in the next 8 minutes, say it or it's over, but we'd like to know if there's some ability to sort of put it out there. What would help? What would enrich you that we can do, support you with? And obviously we'd be open to hearing that after this meeting too. Charles, how can we help? How can we help BOA, Charles? How can we be a support?
With some research around the work that we do, if that is something that you can assist us with doing, particularly in the areas of outcome measures, effectiveness of the services that we provide to individuals, and just following up, seeing what happened to individuals once they leave our programs, whether or not the services that we've provided really impact the rate of recidivism in the state of New Jersey. That would really be helpful. And, seeing whether or not the evidence-based practices that we use can be enhanced, improved upon, and where are the gaps in the services that we've provided.
Thank you, duly noted, and we'll have an expanded conversation about this, Charles. Thank you so much.
Okay.
I've been speaking a lot, but if no one else is speaking up, we also have been working for almost 2.5 years on reforming the whole Workforce New Jersey system, including TANF and general assistance. We convened a stakeholders work group in 2018 that recommended about 20 different things that were in a piece of legislation that was adopted in the Senate and Assembly in April and May of this year. But unfortunately, because of the state's fiscal crisis during the middle of the pandemic, the governor conditionally vetoed the bill. We're actually talking to the governor's office again, actually today, to try and look at the whole bill, the whole comprehensive plan to reform the system here in New Jersey for the first time since it was implemented in the late 90s after welfare reform at the federal level. So certainly, expertise in certain areas like that, as well as research partnership would be really helpful to us in, to push that forward.
Thank you, Renee. Thank you very much. Duly noted. Thank you.
Yeah, I would like to echo the support with research, especially with minority-owned smaller businesses. To include them in research projects that affect the populations we're serving. Also, inter and intra-departmental forums like this to really get more information about what other departments can offer the community, how we could connect and collaborate. Definitely, any trainings that are trainings, leadership trainings that will support us in more of the anti-racist, anti-everything. No, I'm sorry. More healthy, building more healthy systems. Creating more healthy systems within our organizations.
Thank you, Gena, very much. Yes, duly noted. Thank you.
I would just like to thank the School of Social Work for always sending us really good interns. I have a few interns this semester as well, and they're doing a great job, and just want to say thank you.
Rosalind, thank you.
That's a great point. A lot of the schools are struggling with how they're managing the internships and the field placements. And I have to say that you guys have been doing a good job. So
I'd like to thank you as well. I don't know how we end up always, Bernardo, matching the students with the program elements that we have and getting these really good fits. But again, you've done it again. We have a great group and they have been invaluable during this pandemic.
Absolutely. Yes.
Thank you very much, Lori and Gena. Thank you. Thank you. Well, we may be coming to the end of our time here today for our session, but I'm having a lot of ideas about next steps among ourselves, with ourselves. This is our sort of inaugural Voices from the Field get together, and we'll be doing 2 of these in the spring on other topics and likely reaching out to some of you and to others, but we'll be making sure that everybody is invited, everybody's contacted, and that we have a more explicit profile of the Field Education Office and the work that we do together. We consider you part of the Field Education Office, quite honestly. Without you, we don't have efficacy, we don't have purpose. So you're with us, and we're happy when it works, and when it doesn't, we're happy to work it out so that it does. We really appreciate the partnerships, and I know everybody from the Field Education Office who I have the good fortune to work with feels the same way. We're deeply grateful for all of your time, including for today. This was a great opportunity for us to sit together, and I think, as Susan said, to think about being together. Maybe that was Gena. I can't remember which one of our wonderful clergy said that, but it was about being together and not looking beyond ourselves just now. Let's look at ourselves and be together. Well, thank you very much. I want to thank everyone for attending today and for the good questions and comments. We have some more work to do, obviously. We're hoping for a better 2021, but we'll have to see. Susan did say Womanspace, they found themselves always pivoting. And so I expect we've got some more always pivoting to be doing here. But I want to thank everybody and look forward to seeing you again soon, and hope all are well, and just take good care. I miss everybody, and I'll look forward to seeing you in person before too long. Everyone be well. Take care.
Thank you.